Question 1. Mrs. Thompson is a 58-year-old female admitted to the medical surgical unit for the management of her chronic hypertension and newly diagnosed type 2 diabetes mellitus. She has been prescribed insulin for blood sugar management and an antihypertensive medication to control her blood pressure. While monitoring her vital signs, you notice that her blood pressure is elevated at 106 to 100 mmHg. Taking the prescribed antihypertensive medication, what is your most appropriate course of action? A. Increase the dosage of her antihypertensive medication without consulting the physician. B. Continue monitoring her blood pressure every 15 minutes and administer another dose of insulin. C. Inform the physician about her elevated blood pressure and discuss possible changes to her treatment regimen. D. Discontinue the insulin and antihypertensive medication and document the change. Answer. C. Explanation. The most appropriate course of action in this scenario is to inform the physician about Mrs. Thompson's elevated blood pressure and discuss possible changes to her treatment regimen. Hypertension is a chronic condition, but sudden elevations or failure to control blood pressure despite medication may indicate the need for an adjustment in therapy. This could include changing the medication, adjusting doses, or adding medications. It is important not to independently adjust medication doses, as in option A, without consulting the physician. Monitoring blood pressure every 15 minutes, option B, may be necessary, but the first priority is communication with the healthcare provider. Discontinuing medications, option D, without physician consultation could result in adverse outcomes. Question 2. Which of the following is the most effective method for preventing surgical site infections (SIS) in patients undergoing elective surgery? A. Administering prophylactic antibiotics only after the surgery is completed. B. Ensuring that the patient is well hydrated and adequately nourished prior to surgery. C. Keeping the surgical area sterile during the procedure and maintaining aseptic technique. D. Encouraging the patient to shower with antibacterial soap the day before surgery and apply antiseptic ointment. Answer. C. Explanation. The most effective method for preventing surgical site infections is maintaining a sterile surgical environment and adhering to aseptic technique during the procedure. This involves proper hand hygiene, sterile instruments, and ensuring the surgical field remains uncontaminated. Prophylactic antibiotics, option A, should be administered before the incision is made, not after the surgery is completed, to reduce the risk of infection. While patient hydration and nutrition, option B, are important for overall health and healing, they do not directly prevent SIS. Preoperative showering and the use of antiseptic ointments, option D, may help in some cases, but sterile technique during surgery is the most crucial factor. Question 3, scenario-based. Mr. Reed is a 72-year-old male who has been recently diagnosed with chronic obstructive pulmonary disease (COPD). He is currently receiving oxygen therapy at home and has a history of frequent hospitalizations for exacerbations of his COPD. He has expressed concerns about his ability to manage his medications and use his inhaler correctly. Which of the following is the most appropriate nursing intervention to assist Mr. Reed with his medication management? A. Instruct him to use the inhaler only when he is experiencing shortness of breath. B. Schedule a home visit to assess his inhaler technique and provide education on proper medication use. C. Encourage Mr. Reed to stop using the inhaler if he does not feel immediate relief. D. Recommend that Mr. Reed only uses oxygen therapy during sleep to prevent dependency. Answer. B. Explanation. The most appropriate nursing intervention is to schedule a home visit to assess Mr. Reed's inhaler technique and provide education on proper medication use. COPD management includes the use of inhalers for medication delivery, and proper technique is crucial to ensure the medication is effectively reaching the lungs. A home visit allows the nurse to assess technique in the environment where Mr. Reed uses the inhaler and can personalized instruction. Instructing him to use the inhaler only during shortness of breath, option A, is incorrect because inhalers are typically prescribed for routine use to manage symptoms, not just when shortness of breath occurs. Stopping the inhaler if no immediate relief is felt, option C, could lead to improper medication management and exacerbate the disease. Oxygen therapy should be used as prescribed, not just during sleep, option D, as it is crucial for maintaining adequate oxygen saturation during daily activities as well. Question 4. A 68-year-old patient, Mr. Anderson, has been diagnosed with congestive heart failure, CHF, and is admitted to your medical surgical unit for exacerbation of his condition. He is receiving remunuretics for fluid overload and oral ACE inhibitors to manage his condition. During assessment, you observe that his blood pressure is 96 mmHg, his heart rate is 100 bpm, and his respiratory rate is 22 breaths per minute. Mr. Anderson reports feeling dizzy and lightheaded when attempting to stand. Based on these findings, what is the most appropriate next step in managing Mr. Anderson's care? A. Continue administering diuretics as ordered and encourage him to increase his oral fluid intake. B. Discontinue the ACE inhibitors immediately and monitor his vital signs. C. Notify the physician to discuss adjusting his diuretic dosage and potentially adding vasopressor to improve blood pressure. D. Increase the dosage of his diuretics to relieve the fluid overload more effectively. Answer. C. Explanation. The most appropriate action is to notify the physician about Mr. Anderson's symptoms and discuss adjusting his diuretic dosage and possibly adding vasopressor. The low blood pressure, dizziness, and lightheadedness indicate that he may be experiencing hypotension, possibly as a result of excessive diuresis fluid removal, which can reduce circulating blood volume. Diuretics are essential in CHF, but careful monitoring and adjustments are needed to prevent hypotension. Discontinuing ACE inhibitors, option B, could exacerbate his condition, as ACE inhibitors help reduce afterload and improve heart function in EHF patients. Increasing the diuretic dosage, option D, would worsen the hypotension. Encouraging fluid intake, option A, is not appropriate, as it could exacerbate his condition further. Question 5. A post-operative patient is recovering from a laparotomy and is being managed for pain control with an opioid analgesic. The nurse assesses the patient's respiratory rate, which is 10 breaths per minute, and notes that the patient is drowsy but arousable. The nurse also observes that the patient's oxygen saturation level is 88%. What is the most appropriate immediate nursing intervention? A. Administer the prescribed dose of naloxone, Narcan, to reverse opioid effects. B. Continue to monitor the patient's respiratory status every 15 minutes and document the findings. C. Increase the patient's oxygen flow rate and notify the physician about the low oxygen saturation. D. Administer high dose of the opioid analgesic to manage the patient's pain effectively. Answer. C. Explanation. The most appropriate intervention is to increase the patient's oxygen flow rate and notify the physician about the low oxygen saturation. The patient's low oxygen saturation, 88%, and low respiratory rate, 10 bpm, are concerning for respiratory depression likely due to opioid analgesia. Administering naloxone, option A, is a possible action if the patient's respiratory status worsens. Initially providing oxygen and notifying the physician for further instructions is critical. Continuing to monitor, option B, is insufficient in this case because immediate action is necessary to address respiratory depression. Administering more opioids, option D, is dangerous and could worsen the respiratory depression. Question 6. Mr. Collins is a 55-year-old male patient with a history of type 2 diabetes, hypertension, and chronic kidney disease (CKD). He is hospitalized for an exacerbation of his kidney disease and require Roman fluid therapy to manage dehydration. His serum creatinine level has increased significantly over the past 24 hours. As the nurse, you are tasked with adjusting his Roman fluid management to prevent renal damage. Which of the following is the most appropriate strategy for managing Mr. Collins' fluid therapy? A. Administer Roman fluids at rapid rate to correct dehydration quickly and support kidney function. B. Monitor his urine output closely and adjust fluid therapy based on his renal function and electrolytes. C. Discontinue Roman fluids immediately to avoid further strain on the kidneys. D. Provide Roman fluids with high concentrations of sodium to improve renal perfusion. Answer. B. Explanation. The most appropriate strategy is to monitor Mr. Collins' urine output closely and adjust fluid therapy based on his renal function and electrolytes. In patients with CKD, particularly with elevated serum creatinine, careful fluid management is critical to avoid fluid overload or worsening kidney function. Rapid administration of fluids, option A, can exacerbate renal dysfunction and lead to fluid overload, especially in CKD patients. Discontinuing fluids, option C, could lead to further dehydration and worsen renal function. Roman fluids with high sodium concentrations, option D, are not recommended, as sodium retention can worsen fluid imbalance and hypertension in CKD patients. Question 7. Mrs. Peterson, the 65-year-old patient, is receiving chemotherapy for breast cancer. She is experiencing significant nausea and vomiting post-treatment, which are common side effects. In addition to managing her nausea with antiemetics, The nurse is aware of the potential for electrolyte imbalances due to the vomiting. What is the most appropriate action for the nurse to take in managing Mrs. Peterson's care during this period? A. Administer antiemetics as prescribed and monitor her vital signs and weight daily. B. Limit oral fluid intake to prevent further electrolyte disturbances. C. Increase her intake of sodium-rich foods to compensate for fluid loss. D. Restrict fluids entirely until her nausea and vomiting resolve. Answer A. Explanation. The most appropriate action is to administer antiemetics as prescribed and monitor vital signs and weight daily. Nausea and vomiting can lead to dehydration and electrolyte imbalances, so careful monitoring and maintaining fluid balance are essential. Antiemetics help control nausea, and vital signs weight monitoring allows for early detection of dehydration or other complications. Limiting fluids, option B, is counterproductive in this case as proper hydration is necessary to prevent electrolyte disturbances. Increasing sodium intake, option C, is not a safe recommendation without specific electrolyte measurements. Fluid restriction, option D, would worsen the patient's condition and recovery. Question 8. A 72-year-old male patient, Mr. Roberts, is diagnosed with a stroke and has been admitted to the medical surgical unit. His rehabilitation team is working with him on regaining motor function. As part of his care plan, the nurse needs to ensure that he is safe during his recovery process. Which of the following actions is most critical for preventing complications during his early recovery phase? A. Encouraging him to perform exercises that he is capable of on his own without assistance. B. Using restraints to prevent him from falling out of bed during his rehabilitation exercises. C. Implementing a full risk assessment and ensuring that the environment is free of obstacles. D. Administering pain medications before each physical therapy session to enhance mobility. Answer C. Explanation. The most critical action is to implement a full risk assessment and ensure that the environment is free of obstacles. Stroke patients are at high risk for falls due to impaired mobility, balance, and coordination, and preventing falls is crucial for patient safety. Encouraging independent exercise, option A, may be unsafe if the patient is not yet fully capable, as it could lead to further injury. Using restraints, option B, should be avoided, as they can increase the risk of injury and lead to other complications, such as pressure ulcers. Administering pain medications before physical therapy, option D, is a part of pain management but should not be the primary focus for preventing falls or complications. Question 9. A 40-year-old patient MS. Davis presents with signs of dehydration, including dry mucous membranes, low blood pressure, and tachycardia. She has been vomiting and experiencing diarrhea for the past 24 hours. Her labs show elevated hematocrit and serum sodium levels, indicating dehydration. What is the most appropriate initial treatment to manage her dehydration? A. Administer hypoton Roman uids, such as 0.45% saline, to rehydrate the patient quickly. B. Begin oral rehydration therapy with a solution containing glucose and electrolytes. C. Administer isoton Roman uids, such as 0.9% normal saline, to restore fluid volume. D. Limit fluid intake to prevent the risk of fluid overload. Answer C. Explanation. The most appropriate treatment for dehydration in this patient is to administer isoton Roman uids, such as 0.9% normal saline. Isotonic fluids are commonly used to restore extracellular fluid volume and improve hemodynamic status in patients with dehydration, especially when they are unable to take oral fluids. Hypotonic fluids, option A, are not recommended initially, as they may cause a shift of fluid into cells and exacerbate hyponatremia. Oral rehydration, option B, is effective for mild dehydration but is less appropriate for patients with moderate to severe dehydration who require omen therapy. Limiting fluid intake, option D, would worsen the patient's dehydration and exacerbate symptoms. Question 10. Mr. Harris, a 60-year-old patient with chronic kidney disease, is being prepared for hemodialysis. He expresses concerns about the process and its potential complications. Which of the following is the most important information to include when educating Mr. Harris about hemodialysis? A. Hemodialysis is a permanent solution for kidney failure and will eliminate the need for a kidney transplant. B. The dialysis process involves the use of a machine to filter waste and excess fluid from your blood. C. The procedure is quick and typically only takes 30 minutes to complete. D. Hemodialysis can cure kidney disease and restore kidney function to normal levels. Answer B. Explanation. The most important information to provide to Mr. Harris is that hemodialysis is A procedure that involves the use of a machine to filter waste and excess fluid from the blood. Hemodialysis is not a cure for kidney disease, it is a life-sustaining treatment for patients with end-stage renal failure. Option A is incorrect because hemodialysis does not eliminate the need for a transplant if it is required. Option C is incorrect because hemodialysis typically takes 3-5 hours per session. Option D is inaccurate because hemodialysis does not restore kidney function to normal levels. It helps manage symptoms and prevent complications. Question 11. A 55-year-old female patient, Mrs. Larkin, is admitted with a diagnosis of acute exacerbation of chronic obstructive pulmonary disease (COPD). She is currently on supplemental oxygen at 2 Lmin via nasal cannula. The nurse notes that her respiratory rate is 24 breaths per minute and her oxygen saturation is 88%. Mrs. Larkin is complaining of increasing shortness of breath and a productive. What is the most appropriate nursing intervention to improve Mrs. Larkin's oxygenation status? A. Increase the flow rate of oxygen to 6 Lmin and encourage deep breathing exercises. B. Administer prescribed dose of bronchodilators and reassess oxygen saturation. C. Provide non-rebreather mask to administer 100% oxygen immediately. D. Encourage oral fluid intake to thin mucus and facilitate expectoration. Answer B. Explanation. The most appropriate action is to administer the prescribed bronchodilator and reassess oxygen saturation. Bronchodilators help open the airways, relieve bronchospasm, and improve ventilation in patients with COPD, increasing the oxygen flow rate. Option A may not be effective and could lead to oxygen toxicity, especially in patients with COPD who are at risk of respiratory depression. A non-rebreather mask option should only be used in severe hypoxia, and it may not be indicated unless the oxygen saturation continues to drop significantly. Encouraging oral fluids, option D, can help with mucus clearance but does not directly address the oxygenation issue. Question 12. A 30-year-old female patient is admitted to the hospital with acute pancreatitis. Her history includes gallstones and alcohol use. The patient is experiencing severe abdominal pain, nausea, and vomiting. The nurse is preparing to administer pain medications and monitor the patient for any complications. Which of the following is the most appropriate nursing intervention for managing her condition? A. Administer opioid pain medications as prescribed and monitor for respiratory depression. B. Encourage the patient to drink fluids to flush out toxins and prevent dehydration. C. Initiate a low-fat diet immediately to prevent exacerbation of pancreatitis symptoms. D. Prepare for an abdominal CT scan to assess for pancreatic necrosis or pseudocyst formation. Answer A. Explanation. The most appropriate action is to administer opioid pain medications as prescribed and monitor for respiratory depression. Severe pain is common in acute pancreatitis, and opioids are commonly used to manage pain, but careful monitoring for respiratory depression is essential, as opioids can suppress the respiratory drive. Encouraging oral fluids, option B, is not advisable during the acute phase of pancreatitis, as the patient needs bowel rest. A low-fat diet, option C, is generally indicated after the acute phase, not during it. An abdominal CT scan, option D, is a possible diagnostic tool, but pain management and stabilization should take priority in the acute phase. Question 13. Mr. Lopez, a 70-year-old male, is admitted with a stroke and is currently receiving intravenous tissue plasminogen activator (EPA) therapy to dissolve the clot in his brain. He is at risk for developing a hemorrhagic transformation of the stroke. As the nurse, you are monitoring Mr. Lopez for any signs of complications. Which of the following findings would be most concerning and warrant immediate intervention? A decrease in the patient's level of consciousness and headache. B. Slight increase in blood pressure to 169 mmHg. C. Sudden onset of nausea and vomiting without any other neurological deficits. D. Slight difficulty in speaking with mild dysarthria. Answer A. Explanation. A decrease in the patient's level of consciousness and the onset of a headache would be most concerning and require immediate intervention. These symptoms suggest a potential hemorrhagic transformation or cerebral hemorrhage, a serious complication of TPA therapy. Monitoring for neurological changes is essential in patients receiving thrombolytic therapy. A slight increase in blood pressure, option B, could be a normal response, but should still be monitored. Nausea and vomiting, option C, can occur but are not specific to hemorrhagic transformation. Mild dysarthria, option D, is a common post-stroke symptom but is not immediately alarming. Question 14. A 45-year-old male patient, Mr. Martin, is undergoing treatment for tuberculosis TB with a combination of antibiotics including isoniazid, rifampin, and pyrazinamide. He reports feeling fatigued and experiencing yellowing of his skin. Upon assessment, his liver enzymes are elevated and his bilirubin level is significantly increased. What is the most appropriate nursing intervention for managing Martin's condition? A. Administer additional anti-TB medications to speed up the treatment process. B. Discontinue the current TB medications and notify the physician about the possible drug-induced liver injury. C. Encourage the patient to increase his intake of high-protein foods to boost liver function. D. Provide additional doses of vitamin B to prevent peripheral neuropathy related to isoniazid. Answer. B. Explanation. The most appropriate action is to discontinue the current TB medications and notify the physician about the possible drug-induced liver injury. Elevated liver enzymes and bilirubin levels indicate liver toxicity, which is a common side effect of the anti-TB drugs, particularly isoniazid and rifampin. These drugs can cause hepatotoxicity, which requires immediate attention and may necessitate modifying the medication regimen. Administering additional anti-TB medications, option A, could worsen liver damage. Encouraging high-protein foods, option C, may not directly hit the liver injury and could worsen the situation. Vitamin B supplementation, option D, is useful for preventing peripheral neuropathy but does not address the liver toxicity. Question 15. A 60-year-old patient, MS Collins, with a history of diabetes, is being managed in a hospital for diabetic ketoacidosis (DK). She has received insulin therapy and intravenous fluids. Her blood glucose level has decreased to within normal range and her acidosis is improving. The nurse is preparing for her transition to subcutaneous insulin. Which of the following actions is most critical to prevent complications during the transition? A. Administer subcutaneous insulin immediately after the patient's blood glucose reaches normal levels. B. Gradually taper the insulin infusion rate to prevent rebound hyperglycemia. C. Ensure that the patient's potassium levels are normal before transitioning to subcutaneous insulin. D. Monitor the patient for signs of hypoglycemia after switching to subcutaneous insulin. Answer. C. Explanation. The most critical action is to ensure that the patient's potassium levels are normal before transitioning to subcutaneous insulin. Insulin therapy can drive potassium into cells, potentially causing hypokalemia. Potassium levels should be corrected and monitored to ensure they are within normal limits before switching from Roman or subcutaneous insulin. Administering subcutaneous insulin immediately, option A, is not safe without ensuring potassium balance. Gradually tapering the insulin infusion rate, option B, is not necessary as long as blood glucose is stable. Monitoring for hypoglycemia, option D, is important but secondary to ensuring proper electrolyte levels. Question 16. Mr. Harris, a 50-year-old patient, is admitted with a myocardial infarction, MI. He is receiving antiplatelet therapy, including aspirin and clopidogrel, as well as a heparin drip to prevent further clot formation. The nurse observes that the patient has developed mild bruising and petechiae on his arms and legs. What is the most appropriate next step in managing Mr. Harris' care? A. Discontinue all anticoagulation medications immediately and monitor the patient for signs of bleeding. B. Continue to administer the anticoagulants as ordered and reassess the patient's coagulation profile. C. Notify the physician and prepare to administer vitamin K to reverse the effects of anticoagulation. D. Increase the dosage of heparin to prevent further clot formation and improve oxygenation. Answer. B. Explanation. The most appropriate action is to continue administering the anticoagulants as ordered and reassess the patient's coagulation profile. Mild bruising and petechiae may be side effects of antiplatelet and anticoagulant therapy, and it is important to monitor the patient's coagulation status. Discontinuing the anticoagulants, option A, could increase the risk of further clot formation and adverse cardiac outcomes. K. Option C is used to reverse warfarin therapy, not heparin. Increasing the heparin dosage, option D, could increase the risk of bleeding and is not recommended without specific physician orders. Question 17. MS. Jackson, a 45-year-old patient, is undergoing chemotherapy for breast cancer and has been experiencing significant fatigue and weakness. Her blood count shows a hemoglobin level of 7.5 grams. The physician orders a blood transfusion. What is the most important aspect of care when preparing MS Jackson for the blood transfusion? A. Check for any signs of allergic reactions to blood products before administering the transfusion. B. Administer premedication with acetaminophen to prevent fever from developing during the transfusion. C. Ensure that the blood transfusion is infused rapidly to correct the anemia quickly. D. Verify the patient's identity and the blood product using two identifiers as per hospital protocol. Answer: D. Explanation. The most important step in preparing for a blood transfusion is to verify the patient's identity and the blood product using two identifiers as per hospital protocol. This is essential to prevent errors in blood administration, such as receiving the wrong blood type. Checking for allergic reactions, option A, is important but not the first step. Administering acetaminophen, option B, is not routinely recommended. There are specific symptoms to address, as fever can be normal response. Infusing the blood too rapidly, option C, can cause complications such as fluid overload, so the transfusion should be administered according to the prescribed rate. Question 18. A 35-year-old woman, MS Taylor, is diagnosed with preeclampsia at 36 weeks of gestation. Her blood pressure is 160/110 Hg and she has proteinuria. The nurse is preparing to administer magnesium sulfate as prescribed. What is the most important nursing action when administering magnesium sulfate to MS Taylor? A. Ensure that magnesium sulfate is infused slowly to prevent respiratory depression. B. Monitor the patient's blood pressure every 15 minutes during the infusion. C. Assess the patient's deep tendon reflexes and urinary output before starting the infusion. D. Discontinue the infusion immediately if the patient develops headache or visual disturbances. Answer: C. Explanation. The most important action is to assess the patient's deep tendon reflexes and urinary output before starting the magnesium sulfate infusion. Magnesium sulfate is used in preeclampsia to prevent seizures, but it can cause toxicity, so baseline assessments are crucial. Monitoring blood pressure, option B, is important but not the first priority when initiating magnesium sulfate. Slow infusion, option A, is not important as ensuring safe baseline measurements. Discontinuing the infusion due to headache or visual disturbances, option D, is appropriate if signs of magnesium toxicity occur, but baseline monitoring takes precedence. Question 19. A 25-year-old patient, MS Green, has been diagnosed with pneumonia and is started on broad-spectrum antibiotics. She is receiving oxygen therapy via nasal cannula and her oxygen saturation is 92%. The nurse is concerned about the potential for worsening respiratory status. Which of the following interventions is most appropriate for MS Green at this stage? A. Increase oxygen therapy to 100% via a non-rebreather mask and monitor for oxygen toxicity. B. Encourage the patient to perform intensive spirometry every hour to improve lung expansion. C. Decrease the oxygen flow rate to 1 Lmin to prevent oxygen toxicity. D. Place the patient in a high Fowler's position to improve lung expansion and oxygenation. Answer: D. Explanation. The most appropriate intervention is to place the patient in a high Fowler's position. This position helps improve lung expansion and oxygenation, which is crucial for patients with pneumonia. Increasing oxygen therapy, option A, to 100% may not be necessary at this stage unless oxygen saturation drops further and it could cause oxygen toxicity. Intensive spirometry, option B, is beneficial but not first intervention in an acute pneumonia situation. Decreasing oxygen flow, option C, is not recommended unless there are signs of oxygen toxicity and the patient is stable on 92% saturation. Question 20. Mr. Foster, a 50-year-old male patient, has been diagnosed with peptic ulcer disease (PUD) and is receiving a combination of proton pump inhibitors (PPIs) and antibiotics for H. pylori infection. He reports experiencing dark, tarry stools. What is the most appropriate nursing intervention for Mr. Foster? A. Continue the prescribed medications and monitor for gastrointestinal bleeding. B. Discontinue the PPIs immediately and notify the physician. C. Prepare to administer activated charcoal to treat potential gastrointestinal bleeding. D. Assess for additional symptoms of gastrointestinal bleeding, such as abdominal pain, dizziness, and hypotension. Answer: D. Explanation. The most appropriate action is to assess for additional symptoms of gastrointestinal bleeding, such as abdominal pain, dizziness, and hypotension. Dark, tarry stools are indicative of melena, a sign of upper gastrointestinal bleeding, which is a known complication of peptic ulcers. The nurse should assess the patient's condition and notify the physician for further evaluation. Continue in the prescribed medications. Option A. Appropriate unless the physician orders. A change in treatment. Discontinuing PPIs. Option B is not warranted unless directed by the physician, as they are essential in treating the underlying PUD. Administering activated charcoal. Option C is not indicated for gastrointestinal bleeding and is more appropriate in cases of poisoning or overdose. Question 21. A 70-year-old female patient, Mrs. Henderson, has been admitted with heart failure HF exacerbation. She is experiencing shortness of breath, edema, and fatigue. The nurse notes crackles in the lungs, increased jugular venous distension (JVD), and a low oxygen saturation level. Which of the following actions should the nurse prioritize in the management of Mrs. Henderson? A. Administer a diuretic as prescribed to reduce fluid overload. B. Perform a 12-lead ECG to monitor for arrhythmias. C. Position the patient in a low Fowler's position to decrease respiratory effort. D. Increase oxygen supplementation to 4 per minute via nasal cannula. Answer A. Explanation. In patients with heart failure, fluid overload is a primary concern. Administering a diuretic, option A, helps reduce the excess fluid and relieves symptoms such as edema, shortness of breath, and crackles in the lungs. Although the ECG option B may be helpful, it is not the immediate priority unless the patient exhibits signs of arrhythmias. Positioning the patient in a low Fowler's position, option C, is not ideal. Semi-Fowler's or high Fowler's position improves lung expansion and decreases the work of breathing. Oxygen supplementation, option D, should be provided based on oxygen saturation levels. However, diuretics are critical to managing fluid overload first. Question 22. A 28-year-old male, Mr. Green, presents with a history of chronic headaches, blurred vision, and nausea. His blood pressure is 100/100 Hg and he is diagnosed with hypertensive crisis. He is started on an intravenous antihypertensive agent. Which of the following actions should the nurse take next to manage his condition? A. Monitor blood pressure every 15 minutes and assess for target organ damage. B. Administer the medication and then reassess the blood pressure after 1 hour. C. Discontinue Roman antihypertensive immediately after achieving normal blood pressure. D. Provide a high-sodium diet to support vascular tone. Answer A. Explanation. In hypertensive crisis, the nurse should monitor blood pressure closely every 15 minutes and assess for signs of target organ damage, such as changes in vision, neurological function, or chest pain. This is crucial to preventing further damage. Option B is inappropriate because the blood pressure should be monitored more frequently than every hour. Discontinuing Roman antihypertensive medication, option C, is not appropriate as blood pressure needs to be controlled progressively over hours. A high-sodium diet, option D, is contraindicated in hypertensive patients and should not be used. Question 23, scenario-based. Mr. Wallace, a 45-year-old male, has been admitted to the hospital with a severe exacerbation of asthma. He is currently receiving high doses of inhaled corticosteroids and bronchodilators, but is still experiencing wheezing, shortness of breath, and use of accessory muscles. His oxygen saturation is 88% and he is showing signs of anxiety. The nurse anticipates the need for additional interventions. What should the nurse do next to address Mr. Wallace's condition? A. Administer short-acting beta agonist, SABA, as prescribed and reassess his oxygen saturation. B. Continue to monitor his vital signs and provide reassurance that the medication is working. C. Encourage Mr. Wallace to take slow, deep breaths and reduce anxiety. D. Prepare for endotracheal intubation, as this is severe asthma exacerbation. Answer A. Explanation. A short-acting beta agonist, SABA, is the first-line treatment for acute asthma exacerbations. It works quickly to relieve bronchoconstriction and improve oxygenation. The nurse should administer the medication as prescribed and reassess the patient's oxygen saturation. Option B is inappropriate because monitoring alone without administering the appropriate treatment will not address the respiratory distress. Encouraging deep breathing, option C, may help with anxiety, but it is not enough to improve the patient's respiratory status. Endotracheal intubation, option D, should be considered only if the patient's condition worsens significantly and other measures fail. Question 24. A 32-year-old pregnant woman in her third trimester, Mrs. Brooks, presents to the clinic with swelling in her hands and feet, headache, and visual disturbances. Her blood pressure is 106/100 Hg and proteinuria is present on a urine dipstick. What is the most likely diagnosis and what should be the nurse's immediate priority? A. Preeclampsia. Initiate antihypertensive therapy and monitor for seizures. B. Gestational hypertension. Provide education about blood pressure monitoring at home. C. Eclampsia. Prepare for emergency cesarean delivery. D. Chronic hypertension. Assess for end organ damage and initiate lifestyle modifications. Answer A. Explanation. The most likely diagnosis is preeclampsia, a hypertensive disorder of pregnancy characterized by high blood pressure and proteinuria. Immediate priority is to initiate antihypertensive therapy to prevent complications such as eclampsia and monitor for seizures which may occur if preeclampsia progresses. Gestational hypertension, option B, does not typically involve proteinuria or the severity of symptoms seen in patient. Eclampsia, option C, involves seizures which have not yet occurred. An emergency cesarean delivery is not warranted unless the patient's condition deteriorates. Chronic hypertension, option D, is less likely given the patient's pregnancy-related symptoms. Question 25. Mrs. Simmons, a 60-year-old female with type 2 diabetes, is admitted for foot surgery due to a diabetic foot ulcer. She has a history of poor glycemic control. The nurse is preparing to administer insulin before surgery. What should the nurse prioritize in this situation? A. Hold the morning dose of insulin and monitor blood glucose levels postoperatively. B. Administer a full dose of insulin to prevent hypoglycemia during surgery. C. Administer a reduced dose of insulin based on current blood glucose levels to avoid hypoglycemia. D. Administer insulin without checking blood glucose levels as prescribed. Answer C. Explanation. In patients with diabetes undergoing surgery, insulin should be administered based on blood glucose levels. A reduced dose, option C, may be appropriate to avoid the risk of hypoglycemia while preventing hyperglycemia. Holding the insulin, option A, is not ideal because maintaining blood glucose within a safe range is critical during surgery. Administering a full dose, option B, could lead to hypoglycemia, especially with reduced food intake or increased insulin sensitivity. Administering insulin without checking blood glucose, option D, is not recommended as blood glucose levels should be assessed before determining the correct insulin dose. Question 26. A 60-year-old male patient, Mr. Smith, who is post-operative day 2 after a coronary artery bypass graft CABG surgery, reports chest pain with inspiration and shortness of breath. The nurse auscultates a pleural friction rub. What is the most likely cause of Mr. Smith's symptoms? A. Atrial fibrillation post-operatively causing chest pain and shortness of breath. B. Pulmonary embolism as a complication of surgery. C. Pericarditis or post-pericardiotomy syndrome. D. Acute myocardial infarction. Answer C. Explanation. The most likely cause of Mr. Smith's symptoms is pericarditis or post-pericardiotomy syndrome, which can occur after cardiac surgery, including CABG. This condition causes chest pain, pleural friction rub, and shortness of breath, typically exacerbated by inspiration. Atrial fibrillation, option A, is common after CABG but is more likely to cause an irregular heart rhythm rather than pleural friction rub. Pulmonary embolism, option B, is serious post-operative complication but typically presents with sudden onset of shortness of breath and is not associated with pleural friction rub. Acute myocardial infarction, option D, would be unlikely since the patient is already post-CABG. Question 27. Mrs. Taylor, a 45-year-old female with a history of chronic kidney disease (CAD), presents with fatigue, edema, and elevated blood pressure. Her serum creatinine level has risen significantly over the past week. What is the priority nursing intervention for managing her condition? A. Initiate continuous renal replacement therapy immediately. B. Administer an antihypertensive medication and monitor renal function closely. C. Encourage increased fluid intake to help flush out toxins. D. Perform a full assessment for signs of impending renal failure, including urine output. Answer B. Explanation. For a patient with CKD experiencing elevated blood pressure and rising creatinine levels, the priority intervention is to administer antihypertensive medication to control blood pressure and prevent further renal damage. Close monitoring of renal function is also necessary. Continuous renal replacement therapy, option A, is typically reserved for patients in severe renal failure with complications like electrolyte imbalances. Encouraging increased fluid intake, option C, is contraindicated in patients with CKD as it could worsen fluid retention. Assessing urine output, option D, is important but does not address the immediate need for blood pressure control. Question 28. A 50-year-old female, Mrs. King, presents to the emergency department with complaints of severe chest pain radiating to her left arm and jaw. She is diagnosed with acute myocardial infarction (OMI). Which of the following is the most appropriate first action by the nurse to manage her condition? A. Administer aspirin to inhibit platelet aggregation. B. Start an intravenous infusion of nitroglycerin for pain relief. C. Obtain an ECG to assess the type of myocardial infarction. D. Begin oxygen therapy at 4 per minute via nasal cannula. Answer A. Explanation. The first action in managing OMI is to administer aspirin, option A, to inhibit platelet aggregation and reduce further thrombus formation. Oxygen therapy, option D, should be initiated promptly, but aspirin is the most important early intervention. Nitroglycerin, option B, can be administered later if needed for pain relief, but the priority is to reduce clot formation. An ECG, option C, should be obtained as soon as possible to assess the type of MI, but aspirin is more critical in the immediate management. Question 29. Mr. Brown, a 67-year-old male patient, is undergoing treatment for chronic obstructive pulmonary disease (COPD) and is being monitored for oxygen therapy. His oxygen saturation is 92%, but he is confused and lethargic. What is the nurse's priority action in this situation? A. Increase the oxygen flow rate to form and to improve oxygenation. B. Administer bronchodilator to relieve his shortness of breath. C. Assess for signs of carbon dioxide retention and adjust oxygen therapy accordingly. D. Notify the healthcare provider to discuss the patient's condition. Answer C. Explanation. In patients with COPD, oxygen therapy must be carefully managed to prevent carbon dioxide retention, which can worsen confusion and lethargy. The nurse should assess for signs of carbon dioxide retention, such as altered mental status, and adjust the oxygen therapy accordingly. Increasing the oxygen flow rate, option A, may worsen carbon dioxide retention in some COPD patients. Administering a bronchodilator, B, may help relieve shortness of breath, but addressing oxygen therapy is the immediate priority. Notifying the healthcare provider, option D, is important but not the first step. Question 30. Mrs. Garcia, a 72-year-old woman, is admitted with a history of stroke and atrial fibrillation. She is prescribed warfarin to prevent thromboembolic events. Which of the following nursing interventions is critical in managing her care while on warfarin therapy? A. Monitor her international normalized ratio INR regularly to ensure therapeutic anticoagulation levels. B. Encourage a diet high in leafy green vegetables to promote clotting. C. Administer warfarin at bedtime to minimize adverse effects. D. Discontinue the warfarin if the patient develops a headache. Answer A. Explanation. Regular monitoring of the international normalized ratio INR, option A, is essential for patients on warfarin to ensure they are within a therapeutic range which helps prevent both clotting and bleeding complications. A high intake of leafy green vegetables, option B, can interfere with warfarin's effectiveness due to the vitamin K content, which may counteract anticoagulation. Administering warfarin at bed, option C, is not necessary and does not affect the drug's efficacy. Discontinuing warfarin, option D, is inappropriate unless directed by the physician based on specific clinical findings.